have the female reproductive tract. So I'm going to show the big model first and then go back to the smaller model and look at some of the differences. The female gonad right here is called the ovary. We have two ovaries, one on the left, one on the right. The egg is actually present from about 20 weeks in utero all the way through your mid-50s, but they don't mature until puberty. So this is where the eggs are going to mature approximately one every month from about age 11 or 12 to about age 55. The egg is then released here and it's collected by these little fimbriae. The fimbriae act like little fingers that are going to call that egg into the fallopian tube. This tube here is the fallopian tube, also called the uterine tube. The egg is going to go into the uterus here. This large muscular organ is the uterus. The top of it would be the fundus. And this is the uterus, and you'll notice it has these folds or rugae. This bottom third of the uterus that goes into the vaginal canal here is called the cervix. So remember, cervix means neck. So this is the neck of the uterus pushing into the vaginal canal. This is the vaginal canal or the vagina. And again, it has all these folds, these accordion-like plates called rugae that are going to allow for expansion. Then if we look here below it, this is our bladder. So you can see why if you have the uterus on top of the bladder, a woman who is pregnant is going to have to go to the bathroom about every 30 minutes. There's just no way around it. And then coming out of the bladder, we have the urethra and of course the external urethral orifice. We also have in front of the bladder the clitoris, which has the same number of nerves that its male counterpart has. It's just smaller. So then we have in the UG diaphragm two openings, external urethral orifice and vaginal orifice. The vagina is normally closed or protected when not in use, and we have two safeguards here. We have a set of inner medial moist hairless lips called Labia Minora, and then on the outside laterally we have a set of dry hair covered lips that have a good deal of subcutaneous fat called Labia Majora, and these serve to help keep the opening closed when not needed. So between the uterus and the bladder, we have a space here. This is called the vesicouterine pouch. Vesico is the term for bladder, so this is vesicouterine. And then behind it here, between the bladder and the rectum, would be the rectouterine pouch. We also have a couple of ligaments here. We have the round, yes, I believe that's the round ligament here. We have the ovarian ligament coming up to the ovary, and then this broad ligament in the background would be the broad ligament. And of course this white structure coming down would be the ureter going into the bladder. See, I think that's all we can see on this model. Let's take a look at the other model and identify again the structures. Here we have the ovary and the ovarian ligament, fimbriae, uterine tube, also called the fallopian tube, the uterus itself with the cervix here, vagina with the rugae, bladder with again the rugae, urethra. The urethra is much shorter in women than it is in men, which is one of the reasons why women tend to get more urinary tract infections. It's just easier for those pesky bacteria to sneak in. Okay? On this one, this right here is the labia minora, and then on the outside would be the labia majora. Clitoris right here, and let's see, we have the ovarian ligament, the round ligament, and all of this is going to be the broad ligament here. And that's the female reproductive.